I
Hi, hi Garima, how are you?
I am fine. How are you?
I'm fine too. Can
I
you
think
hear?
we went live. We went
Yeah,
live. Didn't
yeah, we went live there. I can see there are many people.
yeah, yeah. I forgot to change the audience, I think.
Yeah, it's completely fine.
Yeah, so many people joined. Yeah, I didn't expect so many people to join. Hi, hi, everybody. Just give a nod if we should start the session or wait for 2, 3 more minutes. Hi, please wait before you put in your queries. I cannot read everything. Somebody commented, "Oho, I Arushi."
She's my friend. She's my friend from SMS Jaipur. She's a pathologist too.
Okay, okay.
Oh, thank you so much.
Okay, so I think we should start. Arushi, you are ready?
Yeah, I'm ready.
Hi, everybody. So we have Dr. Arushi, who is my batchmate from UG days, and she is currently a first-year pathology resident in VMMC and Safdarjung Hospital. So, hi, Arushi, how are you?
Hi Garima, I'm fine and I hope you're fine too.
Yeah, yeah. Just let me just thank Dr. Arushi for taking out time from her busy schedule to do this with me. So thank you. Thank you from every one of us. Uh, so hi Arushi, just tell me a little bit about your residency, like how's life and how is residency treating you?
Okay, so life is pretty good, and residency is like always like the first year residence, like it's same for every first year resident, right? So it's a like a roller coaster ride for me from day one to now. So it's been like approximately 7 months and some days. So
Yeah.
initially I was when I joined this department, I was pretty lost because what I expected, it didn't turn out to be like that exactly.
Okay.
But then I grew more and I learned about the department and how it is, how pathology is. And then I started developing more interest in it. So, firstly, it was like more of a clerical work we were given to do, but now since we started seeing slides and doing procedures and everything, so I started to like it more and more. So right now, so I'm in that stage that I love this subject. So I don't think once of leaving it.
Cool, yeah, cool. So how does a lay day in life of Dr. Arushi looks like? Like how does it start? When do you report to your hospital and what all do you do? All the departments and everything. Just we want to know everything about pathology.
Okay, so how my day is like my day in college, like officially the working hours are like 9 to 4. So after
Okay.
that, after that also you have to stay in the college only because you have to screen the slides, like you have to see them before the consultant does and reports them the next day. So yes, you have to stay there, and the time entirely depends on the person and how much interest he's having. So he or she is having. So like I stay sometimes till 5, sometimes at 6, sometimes at 7 also. It all depends on how fast my pace is. Earlier it was slow, now it has improved as I'm knowing this subject more now. And apart from that, like it depends on which sub department you're posted in also. So right now I'm in histopath, so we get free around 7 and 8. But also this is very subjective. Like I'm talking about Safdarjung Hospital because here we have
Yeah.
like 19 PGs. So even though we are having like more caseload, but still like it is
But
divided and
yeah,
segregated. So that's
yeah,
why
yeah.
it is less compared to the other colleges in Delhi. Like like I talked to my friends from RML and other places. Like one friend is Aroma. She's from SMS Jaipur, so she also gets free late only. Like they get free around 9 or 10. So it's different from
Okay.
different
Different
institutions.
institutes. Like, so
Yeah.
where there are more residents, the work will be distributed equally. Like,
Yeah.
you get some free time when there are more residents.
Yeah.
So one thing, उस college में जाओ जहाँ ज़्यादा residents हो, right?
And this was my initial plan. That like that's why I chose this college.
That's why you chose VMMC, right?
Yeah.
Back then we were talking and she told why she chose VMMC because उसमें ज़्यादा residents है. So keep this criteria, guys. So yeah, okay. Then again, why did you choose this branch and the college you are studying? Like pretty much you have answered this, but so we'll hear
Yeah.
it again.
Okay. So this all starts from second year when the subject pathology came in my life. So I started to love it from day one, and I had decided that time only that either I'm going to take a preclinical or a paraclinical because
Yeah,
everyone like
right.
each batchmate of mine knows that how bad I am
Exactly. She
in
wanted
dealing with
only,
patients.
she cannot take clinical branch, guys. We know her from first year and right from D Hall, we knew ki she will not take a clinical branch. Like first day of our MBBS and second day we all knew that Arushi will not go for a clinical branch, right?
Yeah, so that is why I chose this branch. And second thing, it is very vast subject. So I wanted a
Yeah.
subject in which I'll be in touch with medicine. So this subject has that potential. No other subject has that. So plus also I didn't want hectic duties like all the clinical branches people are having now. I can't do that.
But now you cannot say that you do not have hectic duties, right?
Like it is comparatively less. At least I get Sundays off now to sleep, so
Yeah,
it's fair
you
enough.
get Sunday. Yeah.
Yeah.
That's correct. So, how is the transition from MBBS to MD? Like, we have no clue on MBBS level, like, how is MD life? So, just give us some insight, like, how is the transition? How was the transition for you?
Okay, so first thing is that in MBBS, like the teachers and everyone, they treat you like kids. So even if
Correct.
you do something wrong, they won't say anything to you. Plus, you don't have any responsibilities, right, when you are in that
Correct.
MBBS allow thing. But when, as you enter MD, you start getting these taunts from all the consultants. Then now, so you are not MBBS students, you should not be doing this, you should not be doing that, and all. So in MBBS, I had like little knowledge about how this branch actually is for a PG resident because I didn't know initially that they do all this stuff like grossing and everything, and plus my department here is very like wide and it's spread out, so there are so many departments, so that I got to know after coming here only. So but
Okay.
anyways, like the transition is good only. Like you get to know more about the subject.
Correct. So, are you happy with the choice that you made? Or if given an option to change your branch, would you do that?
Yeah, so if you had asked me this question when I was preparing my thesis protocol few months back, then I was very frustrated and I wanted to leave this branch actually. But now, no, now I don't give a second thought. I love this
Okay.
branch. I don't want to leave it.
So, do you get any personal time, like especially in this first year? Is there any toxicity in your department? Like there is so much fuss about toxicity, toxicity. So I want to know it from you, and I hope nobody from VMMC is watching this.
Okay. So talking about toxicity. Toxicity is like in every college, I think. You can't evade from it. So it depends upon your seniors and your consultants. But like the lot of them is good only here, thankfully, thank God. But yeah, there are some people who are toxic, and all you can do is just not overthink about how they behave with you and just hear it from one ear and take it out from other. Like this matters a
Correct.
lot. And because it should not disturb your mental peace. Like they don't count in your lives. Eventually, whatever
Correct.
you are doing is for yourself. They don't
For yourself. Correct.
matter.
Correct. So, what do you have to say about MD versus DNB and whether someone should prefer branch or college, like degree, MD or DNB, does it really matter or all that?
Okay, so I have to answer this in context of
Huh.
pathology only,
Yes,
or
yes, relative to pathology only, yeah.
Okay. So for pathology, I think MD is always superior than DNB.
Okay.
But then there is National Institute of Pathology, ICMR now. So that for
Yeah.
DNB, it's like super amazing. The
Okay.
only disadvantage there is that they get to see more of oncopathola cases. So they don't get
Okay.
that much exposure for normal cases. So if you
Hmm.
choose a MD wala college, so it gives you that benefit that you get to see more patients, like
More.
normal also
Correct.
and abnormal also.
So, is there any patient interaction in pathology? Like any, like somebody who wants path, but he's also thinking like, यार patient interaction नहीं है. So, is there any patient interaction in your branch?
Okay, so there is patient interaction. Like during
Okay.
FNACs, we interact with the patients. We are the ones who are doing it. And you also, only a pathologist does the bone marrow aspiration and biopsy things also. And the procedure, obviously, grossing and all, the
Yeah.
specimens you receive, you have to gross them. So that is basically the tissue interaction, if you would precisely say that. But yeah, there is patient interaction for people who think that it is like completely preclinical, it's completely false notion. Like there is patient interaction in this branch.
Okay. Okay. So, any specific tips for somebody who is waiting for counseling and is thinking to take pathology as MD or as a PG option, right?
Okay, so right now I would want to give an advice to everyone who is waiting for the counseling that just enjoy the time you're having. Like you will not get this time back, and you should go out like wherever you want to go on trips or anything like that. And after that, so you'll become too busy in first year, so you won't get much time. But then second and third year, as it passes on, you kind of manage things. So pathology, metho, you can plan on trips also because you get leaves also per year. So it's
Correct.
but right now you should just focus on yourself. You should uh, build more hobbies. You should enjoy yourself and just talk to people you like. Just don't
Cool, cool.
worry much about anything
So,
else.
so what was your mindset before you joined residency? Any preparation required? Like somebody, I asked a question and somebody was like कि counseling तो हो नहीं रही है, जो branch लेनी है उसी के बारे में पढ़ लेते हैं. तो like, would you advise it or would you not? Like any specific tips before somebody is joining a residency?
Okay, so if you are in that nerd wala category, you can completely choose of study like first studying the books like the branch you're going to join in, and if you think that you love studying and you don't want to do anything else, then it's your personal choice. But for me, I think I didn't do it. I completely enjoyed I think we had like five or
Counseling
six months
period.
before it, yeah. So I completely enjoyed it. I didn't spend time studying it.
Cool, cool. So, when you were preparing for NEET, so
Yeah.
who was your favorite faculty and why? Like faculty both from our college and online platform if you used any. So, like, this is a fun
Okay,
question.
so first, I'll let you know about the college only that
Yeah,
you might be knowing also. Like
yeah.
first is forensic medicine department, Dr. Deepak. Like he
Dr.
was
Deepak,
he
right?
was amazing. So
Yeah.
I loved that subject because he taught it so nicely. And second was Shitid sir from PSM.
Yes,
And yeah, and talking about the online faculty, I used Marrow, so I love
Hmm.
Ila ma'am, Rohan sir, and Abbas Ali sir, and like these were my three favorites from all of them. And apart
Correct.
from that,
Okay.
I also used to see videos of Dr. Preeti Sharma ma'am, and like she is
Okay.
my senior from VMMC only, so she
Correct.
inspired me a lot to take this college.
So cool, yeah, cool. Anything else do you want to add, subtract, or anything for that matter?
Okay, I would just like to advise to all the people who have first of all, I want to congratulate to all those who have qualified and who are waiting for the counseling eagerly. Second, I would advise them that just follow your heart. Just follow your heart and just take the branch you are interested in, literally, because you're going to marry that branch for the rest of your life. Like you're going to be doing it, and you should not compromise a branch. you can change the college, but you should never compromise the
Not
branch.
the
So just listen to your heart, follow your whatever your heart says,
Yes,
and just
because
don't listen to your parents or anyone else because this is
yeah,
you
because
and
it's
this is you.
you. Correct, correct. Like everybody says this now, you cannot divorce a branch. Like
Yeah, you
जो
cannot.
लेना है अपनी मर्जी से ले लो. Do not fall into traps. Like everything like that. So let me just ask if anybody has any doubt about it. So we'll address the doubts. We'll end it in 2-3 minutes, है ना? So if
Yeah.
there is anybody who wants to ask any question, please now is the time. I think nobody wants to ask. Pretty much we took everything, right? है ना?
Yeah, we did. It was really a lovely session talking to you about this
Same
branch.
here, same here, same here, same here. So we'll
And
catch up later on
guys,
WhatsApp.
my friend Garima, she's doing like this amazing job reaching
Please.
out to people, telling them how to focus and like plan your this thing. And so it's like you're doing an amazing job and like
Thank you, Arushi, thank you. Like
follow
we
her,
have a
everyone.
question. We have a question. Do we have to study a lot in pathology and what are the job opportunities? So
Okay.
I think
Yeah.
job opportunities, so she will tell you 2 years after because she is first year only, but studies she can tell, right?
Okay, so yes, if you are a person who doesn't like to study much and वो बड़ा बड़ा books से जिनको डर लगता है, then this branch is not for you definitely because yeah, you have to study a lot. Equivalent to medicine, it is like derm and everything else. It is concise, like it's one separate thing. But in pathology, you study every system. You study general path also and recent advances, and there's so much. So studying this never ends here. So if you love studying, then only you should take this branch. Otherwise, it'll be like I should have taken some branch in which I have to study less. So always join
Correct.
like that. And second thing about the job opportunities
Job
and
opportunities.
so see if you are doing your residency from a very prestigious institute or a good institute for that matter, then the job opportunities are really good for you. Like they select those PGs for SRship only. Like, and second thing is that, yeah, the college matters. And second thing is you can have your private setup also actually, because it
Correct.
won't cost you much as it costs to set up a OT or anything else, like for a surgeon or
Correct.
anything. It is costly, but you can set up your private labs and you can always earn for that matter. So job opportunities are good in this branch.
Cool, cool, cool. So I think we should end the session now. I think most of the queries we have taken, and I'll catch you up on WhatsApp now.
Okay, okay,
It
bye,
was
Garima. Take care.
lovely talking to you and thank you for your time. I personally really appreciate it because I know everybody is busy. Like I've been talking to so many residents now and like taking some time out of their busy schedule is matlab, I cannot say how grateful I am. Thank you.
Thank you to you too. Good night. Take care.
So,
Take care,
a
everyone.
good night. Bye bye. Bye bye. Bye
Bye.
everybody.
Bye bye.